Okay, let's continue. This is a list of things that is evident in your speaking notes for tonight, in which I try to make the case that the authors make in brief. And the first point is that healthcare is too important for good enough to be good enough. In other words, a lot of healthcare organizations are good enough to continue to exist, but they should be better, in the opinion of the authors, and they could be better if they would adopt this new approach called evidence-based management. Good enough is not good enough when people's lives are at stake and when very, very large sums of money are also at stake. It's one thing to survive, but it's quite another to do so to the best of the organization's ability. Number two, top-down authoritative approaches just don't get it when there is a need for teams of professionals to work together to coordinate themselves. Yes, top-down, power-oriented authority can produce a kind of coordination. But the vision in my mind is rows of men in a boat being told when to pull on the oars simultaneously. There's some old movie in which I remember that image. That is not in the spirit of evidence-based management. Coordination comes not through centralized order giving, but rather through an emergence of coordination by teams of people, number one, acting in their own interests as they perceive their interests, and number two, acting in the interests of the organization. And the problem comes when those two things are not aligned. But if they are aligned, coordination will emerge, and that is far better than someone giving orders and creating a kind of artificial or coerced coordination. Number three, there must be continuous improvement. It must begin with the Board of Trustees, and it must be implemented throughout the healthcare organization by the executive administrators and others. Forgive me, but for the moment, let me just make their case. Continuous improvement. I'll try to remember to comment on that later a bit. Number four, culture rather than power is the key. The use of raw power can poison the culture and prevent what the use of power was intended to accomplish. People don't like being ordered to do things, particularly people with professional values, professional knowledge. Number five, this has been shown to work in nonprofit hospitals. The authors say that it is less evident that it works well in government, hospitals, and for-profit healthcare organizations. Number six, there are a lot of educational activities involved with this way of doing things. It begins with the education, quote-unquote, of the board members, of the chief executive, and it works its way throughout the entire organization. Culture change can possibly emerge from below, but I believe is far more likely to be nurtured from the top. If someone tries to force a culture upon other people, that's going to be understood as the coercion that it is. But generally, these kinds of changes begin at the top. And if the leaders will model the behavior that they seek in others and the values that they seek in others, then others are likely to pick up on it. Number 7, not all organizations are the same. In other words, evidence-based clinical practice acknowledges that not all patients are the same, and that not all patients will respond exactly the same way to the same treatment protocols. Likewise, management. Not all organizations are the same. Not all organizations reside in the same political, social, economic environments. And therefore, even though there are benchmarks, there are evidences, hence evidence-based management, of what works, there will be need for adjustment to local conditions. The authors say there are about 30 strategic performance measures. And my response is, thank goodness. I don't want to measure everything or propose to you that everything that can be measured should be measured. 30 sounds manageable for an entire organization to me. Number 9, the key is to create an alignment of interests among the various groups of professionals. If their interests are aligned, or at least appear to be aligned, and I'm not suggesting manipulation here, they're less likely to fight with each other, and they're more likely to get on board and to buy in to this kind of leadership under evidence-based management. Number 10, in the opinion of the authors of our textbook, nonprofit healthcare organizations are the best candidates to do all of this well, because the mission is the quality of services they provide in their service area. They are not driven, at least as much, to earn profits. What they do earn is not called profit. It's a retained earnings, but they're not as profit-driven as the for-profit organizations. And they are generalized institutions that provide a wide variety of healthcare services. Number 11, by benchmarking, in other words, comparing one's organization numbers to the numbers of other comparable organizations, healthcare organizations can identify their relative weaknesses and address those targets, making them part of their continued effort for continuous improvement. I am probably not the best representative of the authors of our textbook. They are the best representatives of themselves, and you can certainly read what they write. And I do not substantially disagree with what they write. But as your teacher, I think it's my responsibility and that it's appropriate for me to share my own opinions about some of this and to indicate where I think maybe some adjustments might be made in these ideas. I approach everything in terms of complex adaptive systems. I see the large healthcare organization as a complex adaptive system within environments which are each complex and adaptive. Let me break now for the 10-minute mark and continue on the next video.